Most men think lasting longer is about stamina. Urologists say it actually comes down to one overlooked muscle almost nobody trains. And I know what you might be thinking right now. You have probably tried everything. Maybe you have slowed your breathing mid-moment. Maybe you have tried distracting yourself mentally. Maybe you have even tried numbing sprays or special condoms that promise to fix the problem from the outside in. And if you are being completely honest with yourself, none of it really worked. Not consistently. Not in a way that gave you genuine, reliable control when it actually mattered. That is not your fault, because everything most men have been told about lasting longer addresses the wrong thing entirely. My name is Dr. Ella Parker. I am a board-certified urologist and sexual health specialist with over 20 years of clinical experience working with men on exactly this issue. I have sat across from thousands of men of all ages, all backgrounds, all fitness levels, who came into my office frustrated, embarrassed, and convinced that what they were experiencing was simply something they had to live with. It is not. And in the next few minutes, I am going to show you exactly why. What I am about to share with you is not a supplement. It is not a hack. It is not something that works for some men and not others depending on age or genetics. This is a clinically validated method rooted in urology and neuroscience, one that targets the actual physiological mechanism behind ejaculatory control, the same mechanism that most men never even know exists inside their own body. Once you understand what this muscle is, where it is, and how to train it, everything changes. Your confidence changes. Your performance changes, and your relationship changes too. So let us start with the foundation. The muscle we are talking about is called the pubococcygeus muscle, most commonly referred to as the PC muscle. It sits within your pelvic floor, a hammock of muscle tissue running from your pubic bone to your tailbone, and it plays a direct, measurable role in controlling ejaculation. Here is the critical point. Most men have never consciously activated this muscle in their entire lives. It fires automatically during certain physical movements, but because nobody ever teaches men to deliberately engage it, strengthen it, or, equally important, deliberately relax it, it remains undertrained, poorly coordinated, and completely useless as a tool for voluntary control. Finding the PC muscle is simple. The next time you are urinating, try to stop the flow midstream. The muscle you squeeze to do that is your PC muscle. That is it. That is the muscle that, once properly trained, gives you real and reliable control over when release occurs. Now here is where most men go wrong. They hear about Kegel exercises, they squeeze that muscle a few times, they feel nothing change, and they give up. The reason it does not work for them is not because the muscle is ineffective. It is because they are only doing half the training. Strengthening the PC muscle matters, but learning to consciously relax it during intimacy matters just as much. Because during high arousal, this muscle instinctively tightens, and that tightening accelerates the release reflex dramatically. Men who can consciously release that tension in real time have a level of control that feels almost unfair compared to men who cannot. Here is the exact 8-week protocol I prescribe to my patients. For the first 2 weeks, the goal is simply activation and awareness. 3 times per day, perform 10 slow contractions of the PC muscle. Squeeze for 5 seconds, release fully for 5 seconds, repeat 10 times. That is 1 set. 3 sets per day. The emphasis here is on the release as much as the contraction. Feel the muscle let go completely before the next squeeze. Weeks 3 and 4 introduce what I call pulse training. After your slow contractions, add a set of rapid pulses, quick, sharp contractions and releases, 1 per second for 30 seconds. This builds fast twitch responsiveness in the muscle, which is what you need to intervene quickly during intimacy when arousal escalates suddenly. Weeks 5 and 6 add endurance holds. After your slow contractions and your pulse sets, finish with 3 holds of 10 seconds each. Squeeze firmly, hold, breathe through it, release. These longer holds build the sustained strength needed for extended control during intimacy. Weeks 7 and 8 are integration weeks. Continue the full protocol, but begin practicing conscious relaxation of the PC muscle during your normal daily routine. Sitting at your desk, driving, watching television. The goal is to develop the ability to release this muscle on command, instantly, without thinking. That automatic release response is the final piece of the control puzzle. 8 weeks. Done consistently, this protocol produces measurable, lasting results. Not temporary, not situational. Genuine physiological change in how your body responds during intimacy. The second element of this method is breath regulation, and this one you can begin using tonight, immediately, with 0 preparation. During intimacy, most men breathe shallowly or hold their breath entirely without realizing it. This is an automatic stress response, and it has a direct and powerful effect on your arousal trajectory. Shallow or held breathing activates your sympathetic nervous system, the fight-or-flight system, which accelerates heart rate, increases muscle tension, and dramatically speeds up the arousal escalation that leads to premature release. Controlled, deep diaphragmatic breathing does the opposite. It activates your parasympathetic nervous system, the calm, regulated state, and directly counteracts the physiological spiral that causes loss of control. The breathing pattern I recommend to my patients is straightforward. Inhale slowly through the nose for a count of 4. Hold briefly for a count of 2. Exhale slowly through the mouth for a count of 6. The extended exhale is critical. It is the exhale that triggers the parasympathetic response and brings your arousal level down in real time. Practice this pattern daily outside of intimacy first. 5 minutes every morning, sitting quietly, simply running through this breath cycle. Within 1 week, the pattern becomes automatic enough that you can access it during intimacy without breaking your rhythm or losing presence with your partner. Combined with the PC muscle training, breath regulation creates a 2-layered system of control, one muscular, one neurological, that works together to give you command over your arousal response in a way that neither element achieves alone. The third and final element is what I call arousal awareness training, and this is the piece that ties everything together, and the piece that most men skip entirely because it requires a kind of internal attention they have never been taught to practice. I use a simple scale with my patients, 1 to 10. 1 is no arousal at all. 10 is the point of no return. The moment release becomes inevitable regardless of what you do. The goal of arousal awareness training is to develop precise, real-time sensitivity to where you are on that scale at any given moment during intimacy. Most men who struggle with premature release have very limited awareness below an 8. They are engaged, they are present, and then suddenly they are at a 9 and it is already too late to intervene. The window for applying breath regulation and PC muscle relaxation has already closed. Arousal awareness training opens that window. It trains you to notice when you are at a 5 or a 6, well before the critical threshold, so that you can apply your techniques early, keep your arousal at a manageable level, and extend the experience as long as you and your partner desire. The way this is developed is through mindful solo practice sessions where the singular focus is internal observation rather than reaching release. During these sessions, you move through arousal slowly and deliberately, pausing regularly to check your internal scale, practicing breath regulation and PC muscle relaxation as you go. Over time, typically 3 to 4 weeks of consistent practice, this awareness becomes second nature. What men consistently tell me after developing this awareness is that it transforms not just their duration, but their entire experience of intimacy. They feel more present, more connected, more in control, not just physically, but emotionally. Because when you are not anxious about finishing too quickly, you are free to actually be there with your partner, in the moment, fully. I want to take a moment to address something that sits underneath all of this for many men: performance anxiety. Because for a significant number of the men I see in my practice, the physical issue and the psychological issue have become completely intertwined. They finish quickly. They feel embarrassed. That embarrassment creates anxiety before the next encounter. That anxiety increases tension and shallow breathing, which makes them finish even more quickly. And the cycle deepens. What I want you to understand is that the 3-part method I have just walked you through addresses performance anxiety directly, not by talking about it, but by eliminating its root cause. When you have genuine physical control, the anxiety has nothing to feed on. It dissolves naturally as competence replaces fear. You do not need to work on your confidence separately. You need to build the skill. Confidence follows skill. It always has in every area of human performance, and sexual performance is no different. Let me summarize exactly what I have given you today. 3 clinically grounded tools that work together as a complete system for lasting longer. First, PC muscle training. 8 weeks, slow contractions, pulse sets, endurance holds, and conscious relaxation practice. This builds the muscular foundation of ejaculatory control. Second, breath regulation. The 4-2-6 breathing pattern that activates your parasympathetic nervous system and slows arousal escalation in real time. Start using this tonight. Third, arousal awareness training. The internal observation practice that gives you a precise, real-time read on your arousal level so you can intervene early and maintain control throughout the entire experience. None of this requires medication. None of it requires equipment. None of it requires anything other than your commitment to a few minutes of daily practice over the next 8 weeks. The men who follow this protocol consistently do not just last longer. They feel better about themselves. They show up differently in their relationships. They reclaim something they thought was gone. That is available to you, starting today. If this video gave you clarity and a real path forward, please like it, share it with someone who needs it, and subscribe for more clinically grounded guidance on men's sexual health and wellness. I answer questions in the comments every week, so if something came up for you watching this, drop it below and I will respond personally. I am Dr. Ella Parker. Thank you for trusting me with this conversation. I will see you in the next one.